Evening, Jane. My name is Taylor, and I was the nurse looking after you tonight, as you already know. Now, we're just completing handover. Is it okay if we complete it in your room and next to you? I just asked that because some patients don't like that. However, we on the peds ward prefer to, just so you can get to know your nurses looking after you tonight a little bit better, along with the nurses getting to know you a little bit better. And we see it as a perfect opportunity for you or your parents to voice any concerns or worries that you may have. Now, is that okay? Perfect, beautiful. Thank you so much, Jane. So tonight, the two nurses looking after you are Danette and Sam. Danette and Sam, this is Jane. Danette, Sam, this is also Jane's mum, Jenny, and Jane's dad, Daniel. Now, Jane is a 16-year-old female who was admitted to the children's ward due to a seizure that occurred 4 days ago at school. Jane has recently been diagnosed with epilepsy 5 months ago, and it was reported that she has been uncompliant with her medication leading up to her original seizure at school. Since Jane's admission to the ward 4 days ago, she has experienced continuous seizures with a minimum of 2 seizures a day, which happened today, unfortunately. Jane's last seizure lasted 3 minutes with tongue biting and incontinence observed. 8.25 milligrams of IV midazolam was given, with a seizure ceasing after the first dose, which was good. Jane continues on oral levetiracetam, 500 milligrams BD. There are no precipitating factors, nor does Jane report any auras. Post-seizure, Jane was on 15-minute vitals, then she was moved to 30-minute vitals, and now she is on hourly vitals. Nothing to be concerned over. Pulse rate of 67 and regular, resp rate of 16, blood pressure of 106/87, oxygen saturation of 98, room air. She had a GCS of 15. However, she is still afebrile with a temp of 37 degrees, which is to be expected post seizure. However, she has been given some paracetamol about 10 minutes ago to kind of help bring that fever down a bit. Now, after her seizure, Jane continues to be withdrawn and drowsy. However, she does engage with the nursing staff when her parents aren't here. Not quite sure why this is, but I am concerned about her mental state and her minimal engagement with her parents. Have kind of highlighted that there might be a problem there. However, today she has had school friends come visit her, which is the first time she has seen them since her seizure at school. So it was nice to see her happy and engaging fully. Jane's risks are obviously her having another seizure and the risks associated with seizure. She's a medium 4 risk, especially after a seizure, so please keep an eye on her and minimize her moving around for the first few hours. Pardon me, sorry. After her seizure, Jane is a 16-year-old female, again, who lives with her mum and her dad, 2 siblings, and her adorable dog, Oscar. She was only recently diagnosed with epilepsy 5 months ago, and prior to admission for her original seizure, she was on Keppra twice daily. However, when taking her medication history, she admitted to the ED staff that she had not been taking her Keppra anymore as she wasn't experiencing the seizures. Mum and dad weren't aware of this and that she had stopped taking it, so they were quite shocked and a little bit angry with this potentially causing her lack of engagement with them. She's now on levetiracetam 500 milligrams BD and is compliant with that, which is really good. She's on 8.25 milligrams of midazolam via IV when experiencing a seizure. Post-seizure, we have noticed a decrease in oral intake by Jane. She has been put on a fluid balance chart to monitor this, and as we are worried that she will become dehydrating, potentially running the risk of her having another seizure. So we have been encouraging fluid intake just with her recent seizures, as she has also become incontinent, and we've noticed that she's been biting her tongue, which wasn't documented to happen in her original seizure, so that is concerning. So that is something that we need to monitor, obviously, closely. Jane has also had her tonsils and her adenoids out when she was 2 years old. However, we're not concerned about that. Nothing has been documented since. Now, Jane has been alert and orientated to time, place, and person throughout the shift, which is really good. Alright, so going through the A to G physical assessment, Jane's airways has remained clear throughout the shift, even through her seizures. However, we have observed in her last view, she has been biting her tongue, so we need to monitor that, just to make sure her airways remain clear in her seizures. Breathing has been fine throughout the shift with a regular rest rate of 16 and an O2 saturation of 98 on room air, with effortless equal bilateral chest expansions with no wheeze, stridor, or rattling heard. Circulation is normal, BP 106/87, heart rate of 67 and regular. She's warm to touch, capillary refill is less than 2 seconds, which is fantastic. Nil disability, Jane is responsive to voice and is orientated to person, place, and time. Exposure, nil signs of rash, pressure sores, or skin change. We did have a quick look when she was going for a shower this morning. Couldn't find anything. Nothing has been documented on that. What else is there? However, she has been biting her tongue in her last seizures. However, nil signs of infection. I had a look and it looks fine. Jane does have some bruises on her leg and hip from her original seizure from school hitting the ground. However, no concerns with that. VET is low risk and she's moving in and out of bed. Further information throughout the day, Jane is either with her mum or her dad. She's not interacting with them, however, or nursing staff when they're here. She has had friends visit, which is good to see her back to her happy, bubbly self when they were here. Since her admission, we have seen a decrease in mental state as she's not really engaging with anyone and she's quite withdrawn and won't make eye contact. Now, she has stated that she is embarrassed by her epilepsy and that she wishes to be normal again. Jane is at risk of falling, especially post-seizure, so we just need to monitor that. She's also on a fluid balance chart, but input and output have been good, so no concern there. Just need to encourage her keeping her fluid intake in. Met criteria has been met twice today, unfortunately, and it has been called twice due to her seizures. Alrighty, my recommendations for the shift are to monitor her mental state, try to engage with her if you can, and try to get her talking. Maybe have a chat to the parents and see if they've noticed anything. The parents have voiced some concerns, however, about her mental state and the amount of seizures she is experiencing and how they will affect her long term. So if we could arrange to get the doctors to come down and maybe speak to them, or you could answer some of the questions if you guys feel comfortable. Could we arrange for a referral to social work as well, because she has voiced some concern about the amount of school that she's missing as she does have exams coming up. So if we could just arrange that, to arrange some assistance with Jane for her schoolwork. And this could potentially be a stressor for her as well, impacting her mental state, so we need to get on top of that. Could we also maybe arrange for a psychologist to maybe come down and see her and talk through with her about her diagnosis with epilepsy, because I do believe that her embarrassment is really playing a role in her non-compliance after discharge with her medication, potentially. Now, most importantly, she is on hourly obs. However, can you pop your head in every once in a while just to get a verbal confirmation she's feeling okay? We just need to keep on top of her seizures as she is at risk of airway closure now that she is biting her tongue, and just monitor her input and output and upload them to her Thorns Blood chart. And that is it with Jane. Thank you so much.